Hello there, my name is Nancy, and this is...
Hello, my name is Rowan, and we want to welcome you to our show, Hands on Health. This program has been established by Deaf and Hard of Hearing Services, and we're doing it for our community in order to educate and empower you all to make good, appropriate, strong decisions for your health.
So today's topic is lead poisoning, and we have a special guest. Our guest is Kathy Zacharias. And Kathy is from Kent County Health Department, KCHD. And she's going to share some information with us on that topic. Welcome, Kathy.
Thank you.
Welcome.
Thanks for having me.
So KCHD has a lead consultant task force, correct? And can you explain a little bit further what lead is? And first of all, share about what you do there, what your job is.
Sure. So I'm a nurse, and I've been at the health department for almost 13 years. My current role is to do outreach and education about childhood lead poisoning prevention for Kent County.
So when we think about lead, we'd love for you to describe what it is and why it's dangerous.
Yeah, so lead is a heavy metal that can be found in the environment, and it's used in many things, but it is not meant to be in the human body. And when it gets into the human body, it causes damage. So that's why we're here today talking about lead poisoning prevention. And we can talk both about children as well as adults, but it can be in many different things, like lead-based paint used to be used. We had leaded gasoline. Manufacturing can use lead. So it's found in places in the environment and can get into the human body, and that's what we're trying to prevent.
So in looking at adults versus children, what would you consider the greatest risk or dangerous? Or what's the least risk involved in looking at adults versus children?
Yeah, so adults or children can develop elevated blood lead levels, but children, especially young children, like toddler age, are the most at risk. And that's because lead hazards are often found like on the ground where children may crawl around and play. They have hand-to-mouth behaviors where they're crawling around and putting their hands in their mouth, or picking up a toy and putting it in their mouth. And that's a good way for lead to get into the body. If a child is exposed to lead, they'll absorb 4 to 5 times more lead than an adult that was exposed to the same lead hazard. Also, because children's brains are still developing, they're at risk for damage to that developing brain if they're exposed to lead, especially at a young age. But adults can also be exposed to lead hazards as well. And especially if they work in environments where lead might be a hazard, that's really more where they might need to be concerned. Whereas children can be exposed even in their own homes pretty easily.
So it seems that children have a higher risk compared with adults. So let's just maybe talk about adults first, and then we'll talk about children later. For adults, possibly they don't have any children, what kind of concerns should they have about lead and lead exposure, whether it's in their home or in their workplace? And what are some symptoms of lead poisoning in their system, and if they have been exposed to lead, and what should they do if those symptoms come up?
Okay, so lots of questions to break down. First of all, lead can get into the body, like we talked about, by being ingested, like we talked about with children. It can also be inhaled if it's a fine dust in the environment, and get into the body that way. So people that maybe work in the construction industry where they're disturbing lead paint need to be taking precautions, for example, so they don't breathe in that dust. Hand washing to make sure that gets off of their hands, things like that. You had also asked about symptoms, and that's the big thing. Often lead poisoning, unless someone has a very, very high lead level, doesn't have symptoms. And if there are symptoms, they're very vague, and they can look just like a different illness. So maybe a little bit of stomach upset or fatigue or just generally not feeling well, nothing very specific. So the only way to really know if someone has had lead exposure and has lead in their body is to do a test, which can be done by a finger poke, a capillary test, or a blood draw. So, and that's for adults and for children as well.
I see. So if adults are in a working environment and see someone else that may have been exposed to lead and yet their symptoms may be different, is it a possibility that you can be exposed to lead and not have any symptoms? Would it be wise to go to the doctor's office and just let them know that it might be a possibility?
Yeah, so most often there are not symptoms. And hopefully someone working in an environment where there's lead hazards around will know to use proper precautions in that work environment especially.
Yeah, okay, so suppose someone gets tested and they're an adult and they test positive for lead. Is there anything that the doctor can do? Are there any treatments to cure or to take away the lead in their system?
That's a good question that applies to adults and children. Lead generally gets excreted naturally by the body through the urine. And only if lead levels are very, very high do they actually do a treatment. And that treatment's called chelation, and it's an agent that is administered by mouth or IV that binds to the lead and excretes the lead more quickly. But usually just removing the source of the lead poisoning, the body will naturally get rid of the lead on its own.
So what about women who are pregnant and breastfeeding? What do those women do if they discover that they've been tested positive for lead? And how do they protect the baby when they're pregnant, as well as how do they protect the baby as far as breastfeeding is concerned?
I'm glad you asked that, because as we were talking about adults, that's something that I did want to address. Pregnant women are at an increased risk, and there's a couple of reasons for that. First of all, there can be a risk to the pregnancy itself. So lead exposure can lead to miscarriage or preterm birth, hypertension during pregnancy, but it also crosses the placental barrier, so the fetus can also be exposed to that lead. There's a couple ways that a pregnant woman can have lead exposure. It can be a current exposure. For example, they currently, are in an environment where they are ingesting lead or breathing it in. But also, a woman who had lead poisoning as a child can have risk of that lead reemerging in their body through the pregnancy. So if a woman has had lead poisoning as a child, it's a good idea for her to let her doctor know, because they may want to test her at intervals in the pregnancy. If a mom does test positive for lead, typically breastfeeding is still encouraged because it provides such good nutrition for the baby. But the doctor will monitor the mom's blood lead levels and the baby's levels. And if mom's levels get very high, or if the baby's levels start to increase, that's when they would discourage breastfeeding. But in most cases, it's still safe to breastfeed.
Interesting. I've heard a small town west of here that has water that has been affected by lead, and they've had to tell people who live in a certain address or certain zone to not be drinking water from their sink or their faucets and to only drink out of the bottled water. Could something like that happen here in Grand Rapids?
We're actually very fortunate. The Grand Rapids water supply has been very safe. They treat the water with agents to decrease the risk of having lead in the water, and then they test the water. Other municipalities in Kent County, if you have a concern, you can actually request the water testing results from your water supplier, and that will include lead levels. So if that's something you're interested in finding out, you most definitely can. If you live on a well and you're using well water, you can also have that water tested at the health department for $18. So you can gather that water on your own. There's instructions. You can pick up testing kits at the health department and bring that water in to be tested if you'd like as well.
It's interesting that you mentioned well water. When you compare well water to city water, there's a distinction. So which one is more likely to be concerned about, or would you think they're both pretty much the same risk?
I'm not sure that one is more or less likely. It's just that municipal water is tested periodically by the city that provides the water, whereas the well water is only tested if that family decides to test it. So that's why I mentioned being able to test the water. That also, will provide information on, is there an issue in the household? Like, is the water line in the house a problem, or the faucet a problem? So that's why I had mentioned maybe testing if you have well water.
So you've already talked a little bit about testing. Could you explain a little bit more about testing and what it looks like and how that process goes?
Yes, I want to understand that and the ability to get a kit.
Actually, it's really easy. You just walk into the health department and go to the desk, and they can hand you the tubes, and then you take them home and follow the instructions and return it to the health department for testing. So it's a very simple process.
That does sound simple.
And I think that you brought something to show us, right? To show what the kit looks like. If we
Yeah.
could see that, that would be great.
Actually, what I brought is a testing kit for things like paint, just to show you. Some people are interested in knowing if there's ways to test in their own homes. If they see peeling, chipping paint around the windows, for example. And there are lead testing kits that you can purchase. They're not super accurate necessarily. If you have it professionally tested, there is going to be a lot more in-depth testing done, obviously. But if you have something you're concerned about, there are some swabs that you can get, at Lowe's or Ace Hardware or Amazon as well, to do sort of some pre-testing if you'd like. But as I don't know if I'm jumping ahead, but as far as testing the environment, we actually have a grant at the county currently through the Ready by 5 program that allows families in Kent County to request that a sanitarian come to their home to do what's called a home health screening. And they will look for potential health hazards in the home, including lead, and also looking for things like asthma triggers and other safety concerns. And if they find anything, then they will refer and connect you with further testing that might need to be done. So that's a great program that you can access. You can just call the health department and we can get you hooked up. And I can give the phone number directly to the lead program as well, if that would be helpful, instead of going through the main number.
And that service, that's free
It
that you're
is
talking
free.
about?
Yeah. Yep. It's all done by a grant. Because it's very, very
Wow.
expensive to pay for lead testing on your own. I also wanted to tell you, going back to pregnant women, we also have a program, if there is a woman who's pregnant that maybe lives in an older home, built before 1978 are the homes that have concern about lead paint, because 1978 is when lead paint was banned in the United States. But if there's a pregnant woman who wants to find out more about preventing lead poisoning for herself and her child, we can send a nurse out to do a one-time home visit with that woman or that family, and that can be done virtually if they're more comfortable, or we can send materials if they're more comfortable. But that's also a free program that's offered through the health department.
It's interesting because my grandma's house was built in 1920 and nothing's changed. The walls, the flooring. So if we wanted to purchase a home and we like the older homes, are we supposed to ask the realtor beforehand what year the house was built? And if so, have it tested for lead? Would that be the appropriate way to handle it?
Before you buy it, right?
Yes, before buying.
Yeah, so definitely it's appropriate to ask those kinds of questions. Typically what we'll see in like a renter's agreement is they can check a box saying we're not sure if this house contains lead hazards, then that's usually what happens. If a home was built before 1978, especially built before 1950, it is likely to have lead in the home, in the paint. But just because there's lead-based paint does not mean there's a hazard. The hazard occurs when that paint has been disturbed and there's dust or flaking paint. So it's really based a little bit more on whether it's been kept in good repair, whether it's been painted over and encapsulated. So you can also ask if a home has had remodeling done. There's two reasons to ask that. First of all, maybe some of that lead has been removed from the home or is covered up. But you also are wondering, was that remodeling done safely? Because if it wasn't, there could have been lead paint disturbed that is now a hazard because it was not done safely. So those are good questions to ask as well.
Suppose I were to get a kit and do the test, and I found out that my walls, the paint on my walls had lead, and I want to remove it and maybe do a different kind of paint. Can I do that myself safely, or should I hire a professional to do that for me?
That's a good question.
In the ideal world, for the areas of the home that have lead paint or potential lead hazards, a professional is the way to go, but you want to make sure that is a professional that's specifically certified to do lead remodeling. So it's called an RRP certification. You can actually find on the EPA, Environmental Protection Agency website, a link to lead certified contractors in our area. But there's also on the EPA website guidelines on what to look for and how to do lead safe remodeling and how to take precautions for work that you are doing yourself. And there are classes that you can also find to learn how to do lead safe remodeling. So those are available as well, and you can find those on the website also.
So if you think about parents who are possibly not interested or not concerned about lead poisoning in their home because they live in a newer home, but they have children and they go to school and they don't know if their school is an older building, if possibly there could be lead exposure there, should they talk to their administration at the school or ask for it to be tested at the school building? Is that something that parents can do if they're concerned about their children's school environment? What is the best way for them to approach that issue if they feel that might be a problem?
Yeah, so in schools, if they're on the municipal water system, again, that water is tested. If they are providing their own water through a well, then they're required to do testing on that water. But they also need to maintain the internal water lines of the school. There's a grant through the state of Michigan that schools can access to help them know how to best maintain their internal water lines and keeping that safe and well maintained.
So in looking at the paint in schools, there's a possibility they have lead as well. I've noticed that in some classrooms you'll see where it looks as though it may be lead paint because it's shiny.
And how could you know if it was 100%? I mean, obviously we have shiny paint that doesn't have lead in it, right? But that's a great question, Nancy.
Right. Well, and also considering lead paint being present doesn't mean it's going to easily get into the body. School-age children aren't as likely to be, getting into the paint and putting it in their mouths and things like that. So they are at a slightly lower risk. But definitely you'd like the paint to be maintained so it's not peeling and chipping and ending up, on the floor or in the environment. Yeah. I did want to actually mention, you mentioned your grandmother's home. Something people don't always consider is whether their child maybe spends time at a home that is built before 1978. So maybe they live in a new home, but they stay at Grandma and Grandpa's house 3 days a week for childcare, and their house was built in 1920. So thinking about other environments, especially for young children that they may be visiting on a frequent basis. Another thing that I did not mention earlier is the exposed soil can also contain lead. So if a child is playing in soil, like around a house or in a park, that can be a lead hazard as well. So making sure to wash that child's hands really good, not let them, unfortunately, make mud pies and and get into it that way. keeping that soil covered so that they're not exposed is important also.
Yeah, you mentioned grandparents or staying with grandparents, and that brought up a question for me. So I've had grandparents pass away, and then we've gotten some of their china after they had passed, and I know it was made in the early 1800s. And I've never used the china, but I think about could it possibly have lead paint in the paint that was painted on the china? I mean, it's got artwork on it and all of that, but I just wonder if I were to take it down and use it for, for food or eating, is that china safe if it's old?
That's a good question. I don't know if lead paint was used in China. I would probably avoid cooking in any of the old containers like that because the heat can release any lead. Using a test kit like this might work well for that type of situation. But I don't know about China.
And you were talking about the website having, the EPA website having the links to lead and lead testing. Is there a specific website that we can go to check for information about lead poisoning specifically? The best one?
Yeah, actually there's a great one that I would recommend. There's a website that was put together just a couple of years ago through Kent County Health Department and City of Grand Rapids worked together on the website. It's called don'tplayaround.org. And I think they're going to put the link on the website up here. That website is great because it has everything from health information about lead, lead poisoning prevention, environmental information, links to all of these different websites that we've talked about. So you can access all of that from the one place. That website's great too because it actually has an interactive tool that can be used to do a self-assessment. So it works best on like a smartphone, and you click on the self-assessment and it walks you through a series of questions like, do you see any deteriorating paint around your windows or doors? Was your home built before 1978? Do you work in such and such an environment? And it lists different work environments or hobbies that might expose someone to lead. And once the assessment is completed, it actually tells you if your child might be at risk for lead poisoning, and if so, gives you a bunch of links to resources. The website is also can be viewed in Spanish as well. So there's just a toggle switch. You can view it in English or Spanish, and it will link you to lots of different resources and probably more than you'd ever want to know about lead poisoning. So, yeah.
That's great to know. Thank you so much.
Yes, thank you so much for all this information. We really appreciate it. We appreciate the time and this opportunity. So now you all have learned something. Thank you.
So thank you so much for taking the time to watch our program. We will have a new topic next time. So keep an eye out for what it's going to be.
So make sure you follow up with Deaf and Hard of Hearing services. And you can find us on Facebook and subscribe on YouTube. And that way you can see all the future topics and shows. You can support this program at Donate online, and that's www.defhhs.org/donate.
And if you have any topics that you are interested in discussing or questions you might have, something you want to learn more about, go ahead and email us at handsonhealth@defhhs.org. Thank you.
Thank you.